use alternative therapies very much. So when Mark came to see me, I was a little bit skeptical, but I was open because I've tried everything. And I was too weak, as he'll tell you, to actually tap myself, as he explains emotional freedom technique to you later.
So I didn't hear the word, Alison. You were too weak to what?
To tap.
To tap, yeah.
Mark will explain that later.
Right, okay.
So he did that for me, and he worked with me for months. And it was a learning curve for him as well, because he had never worked with anybody as ill as I was.
Yeah.
So we helped each other, and we worked out what worked and what didn't, and what to do. And during this time, we kept a note of everything that we were doing. He would keep his notebook and his records, and I always kept a journal. I've always done that since I became a counsellor. So
Right.
my journal went through my illness before I met Mark, and then obviously when I met Mark, and the rest is history, really. Without sort of going on forever, he helped me regain control of my life. And I guess that's why we're here, because I think that we have a way to help other people now.
Right. Well, that's a wonderful story. And what were the time periods? You said you were 10 months or so in the extreme condition.
Yeah. The time period, I met Mark in May. And
sorry, but
by
what year? May?
2010. Correct me if I'm wrong, Mark, because
that's correct.
Yeah. In May 2010, and we worked. I would say that I was really starting to get up and start moving around a bit by November.
Right. Okay.
And then, of course, I was actually diagnosed in November 2010, which sounds utterly crazy. It took 18 months to be diagnosed.
Good Lord.
After all the tests. But by then, I'd already worked with Mark for nearly 6 months. And I was diagnosed by a psychiatrist, and he offered me CBT, which I'd had, but actually I find that CBT and EFT are quite similar. So it was, I was already starting my journey to getting better by the time I was diagnosed.
Right.
So it was.
And can I ask you, when you were diagnosed, what was offered to you by I take it was a National Health Service?
Now, I'm not going to speak for the whole NHS, simply because I think it's a bit of a postcode lottery with what they have available.
Yeah.
I was offered CBT, as I said. There was also one nurse in the whole of the Greater Manchester area that was assigned to people for ME, but the waiting list for that was over a year, unless I was prepared to go privately. But unfortunately, without working, as most people will know, you can't afford to pay for private medicine.
Yeah.
So that didn't happen. The CBT list, when I went to my GP,
I'm
in Cheshire.
Yeah, sorry to keep interrupting you, but I used to know what CBT is. I couldn't tell you now, but maybe some of our audience don't know either. Can you just tell us what it stands for?
Yeah, cognitive behavioural therapy.
Right. Thank you very much.
It's what the NHS use as the prime counselling therapy for people that need counselling.
Right.
They use CBT. The NHS usually, if people are offered CBT, they're given 6 sessions on the NHS. Unfortunately, as a counsellor, I will tell you that CBT is fantastic for phobias, for traumatic events, but in terms of long-term therapy where, for instance, grief therapy or illness or people that have suffered abuse, it's not always very helpful, because really the counsellor needs to go a lot deeper. But that's a view shared by many counsellors within the BACP, which is the British Association of Counselling Practitioners. And I think it's a view that the NHS have actually started looking at now, because I think they're realising it doesn't touch everything.
Yeah.
However, that is the main therapy the NHS uses now.
Right.
As we speak.
And in your experience, it is ineffective on ME? Is that your...
No, I wouldn't say it's completely ineffective. I'd say it was quite similar to EFT and what we were doing in certain respects.
Yeah.
But what it doesn't do is it doesn't touch on what caused the illness in the first place.
I see, yeah.
And that is the difference between what we do and what CBT does. CBT concentrates on moving forward, on taking baby steps and moving forward. What we want to do is move forward, but also find the triggers that created this in the first place and get rid of them.
That sounds marvellous. Very, well, it sounds pioneering, if I say so.
Yeah.
Right, well, thank you very much indeed. I'm sure we'll come back and draw on your experience in due course, but now I'd like to ask Mark if you'd like to tell your side of the story and anything before that you feel will be helpful to the people on the webinar.
Thanks, John. Well, my side of the story was that I was actually working in financial services for rather too long, and I went into something called NLP, which is neuro-linguistic programming, which Paul McKenna, amongst other people, use, which really helped me to realise I was in the wrong profession and I needed to do something to help people. So from that I got to learn about emotional freedom technique, or EFT for its shortened name, which really deals with the subconscious and is based in ancient Chinese medicine, which suggests that we're all made up of energy and that negative emotions and experiences cause a block in our energy. And by physically tapping on ourselves, we can start to unblock those blocks to get our energy flowing again. And I guess the best way to describe what we do is like acupuncture, but without the needles. So the great thing about EFT, and particularly with things like fibromyalgia and ME, is that we can teach people to tap on themselves, or in certain circumstances, if it's too painful, they can imagine themselves tapping on themselves, to help in between sessions that they would have with people like ourselves. So we're very much along the lines of helping people to help themselves, and that was very much the case with Alison. As she pointed out, it was a complete learning experience for me. The actual email which somehow got to her was asking if people wanted some sessions for a book that I planned to write in conjunction with a personal trainer, about sort of getting fit in the psychological barriers that were stopping people from eating the right foods and staying at the gym.
Yeah.
And so this email came back saying I've got fibromyalgia, and I'm being perfectly honest, I didn't even know what that meant at the time.
Good.
But it felt a challenge worth taking on, and one of the mantras of EFT is to try this on everything, so it can work from anything from a phobia about snakes or spiders right up to helping people get rid of horrific things such as ME and fibromyalgia. So we went through it, and I think the thing that really helped was Alison's positive attitude, despite everything that she'd been through, and she's only touched on a small part of a horrific time that she went through that she's documented in her book, which led to a point where her body's just essentially packed up on her and said, I've had enough of this, and you've got to stop. So we worked over a period of time, and as Alison said, sort of after about 6 months she was starting to feel more in control of her life, and that corresponds with the normal sort of what was classed as a recovery period from ME, which is averaging about 7 years. Although there are many people that have had this disease for in excess of 20 years. So our goal, if you like, is to help people to help themselves and give them the tools to reduce that recovery time quite substantially. And again, as Alison said, because we tried a few things, some worked better than others, we've now come up with a program where we can help people recover in a lot less time. And as Alison had said, one of the main things is getting back control of your life so that you can do other things. Now, we're not saying that EFT and all the other things that we do will help you fully recover, but it will put you in a position where you can take control of your life and do the other things like change diets and start exercising that will substantially increase the recovery time.
Right. Well, thank you, Mark. I'm glad I asked Alison about dates, because in view of what you've just said, I calculate it's 2 years since you met, 2 years ago this month.
Oh, so it is. Our anniversary, Mark.
Yes, happy anniversary, Alison.
Congratulations. And I was just going to like to ask Alison if you would like to say, what your condition is, how you are now, what degree of the condition still remains, or just to give us an idea what's been achieved by you two in 2 years.
Well, I'm not completely cured. I will admit, hold my hands up to that. I won't be running any more marathons, that's for sure. I am back working. I am generally fine day to day. I have flare-ups, but I know how to handle these flare-ups now. I don't push myself. I've learned how to work out what the triggers are, which again is part of what we do, because when you're very ill, it's very hard accepting what it is that triggers the bad spells in that illness. And with my counselling, I dig deep, and I try to pull out what it is that triggers a lot of the stuff that sets up these flare-ups. And people that are suffering from this condition will tell you that there seems to be no rhyme or reason to them. It's not strictly true. I know I hold my hand up. Today I'm struggling a bit. My dad had an accident. He's fallen down the stairs. I'm driving up to Scotland at the early hours of the morning. I'm worried, and I'm stressed. So I'm aware that I could trigger something here. So I'm being very careful with how I deal with things, and I learned techniques and how to do that. So it's about getting your life back, and I feel I've got my life back now, albeit slightly different, but it's better. I feel so much more in control.
That's a very important distinction. Say you've got your life back, but it's a different life. And well, it's not for me to say, but I mean, I presume that that means you've chosen to make your life different and hopefully better in a way that that's great.
That suits me, and it's
that's a very good way of putting it.
Yeah, it's finding what's important to each person, because everybody's an individual, aren't they? So the same thing isn't going to work for everybody. That's just not going to happen. Right. Everybody is different, and everybody holds different things in their life important, differently important. So it's about finding what is important to these people, and then working on these so that they can resume their lives and feel like they're living a worthwhile, happy life without feeling the effects of the illness.
Yeah. Well, now that's very interesting. Thank you very much for that, Alison. What I want to do is, we've got it's just gone 8:30. I want to give you another sort of 15 minutes, let's say, to talk about both what you do, what the practices you've evolved, because they'll probably mean to many of our audience who already know something about it, they'll probably mean a lot more than to me, but I find it fascinating. And also to tell us about what's in your book. And then at about 1:45. I'd like to throw it open to questions. I know we've got some very knowledgeable people